Introduction to Health Anxiety. In today's video, we're going to be talking about health anxiety, also referred to as hypochondriasis. I'll be discussing some of the symptoms of health anxiety and the various problems it can cause in a person's life. Hi everyone. Anxiety and worries about health are some of the most common concerns that people experience. This is often associated with fears of sickness, pain, disability, or even death. In this video, we'll explore what health anxiety looks like, its symptoms, and the problems it can lead to. But before we dive in, just a couple of disclaimers. I'm a registered psychologist in the province of British Columbia, Canada. This video is for informational purposes only and is not a substitute for professional advice from your doctor or mental health professional. Defining health anxiety. There are several terms used to describe health anxiety. The most commonly known is hypochondriasis. More recently, the diagnostic term has changed to illness anxiety disorder. Regardless of the terminology, health anxiety centers around a preoccupation with having or developing a serious, undiagnosed medical condition. Importantly, illness anxiety disorder is not the anxiety someone might feel after being diagnosed with a serious medical condition like cancer. Rather, it's the fear of developing such a condition or worrying that one already has it without being diagnosed. Symptoms and misinterpretations. People with health anxiety typically have no significant physical symptoms, or the symptoms are very mild. For instance, someone might experience occasional headaches and fear they're caused by a brain tumor, even though the headaches are mild, intermittent, and appear mostly during stress or dehydration. The anxiety isn't about the symptom itself, it's about what the symptom means. It's not the headache that causes anxiety, but the belief that the headache is a sign of a brain tumor or another serious neurological issue. Preoccupation and information seeking. This anxiety often leads to a preoccupation with perceived illness. Individuals may compulsively search for symptoms online or go down an anxiety-provoking rabbit hole of researching diseases. Hearing stories about others with similar conditions, or reading health-related news, can heighten their fears. Interestingly, health anxiety does not usually respond to evidence or reassurance. Medical tests that come back normal or a doctor's reassurance don't bring lasting relief. In fact, these reassurances may actually increase the anxiety in some cases. Reassurance and doctor shopping. A person with health anxiety may repeatedly visit doctors or request multiple diagnostic tests. Even if these tests come back negative, they may believe the tests were flawed or missed something. This often leads to seeking second opinions or repeating the same tests, what we call doctor shopping. Ironically, attempts to find reassurance can worsen the anxiety. Seeking medical attention can become a safety behavior, which only reinforces the fear and preoccupation. Behavioral patterns and social strain. Health anxiety often dominates a person's thoughts and becomes central to their identity. They may excessively talk about their health concerns in social situations, seeking constant reassurance from friends and family. Over time, this can lead to frustration and strain in close relationships. People with health anxiety may also engage in repetitive behaviors, such as checking their bodies for signs of illness. For example, if someone fears they have throat cancer, they might frequently examine their throat, swallow repeatedly, or prod the area, which can ironically increase sensitivity and reinforce their fears. Avoidance and missed opportunities. Avoidance is another key issue. Individuals may avoid situations that trigger anxiety, such as visiting hospitals or engaging in physical activity. For instance, someone who fears having a heart attack might avoid exercise, even though exercise could be beneficial for heart health. This avoidance can actually increase health risks. Consequences of excessive medical testing. Excessive medical attention can also lead to physical harm, referred to as iatrogenic complications. For example, someone who is anxious about gastrointestinal symptoms might undergo an invasive procedure like a colonoscopy. While this test can help rule out disease, it also carries side effects like bloating, pain, or infection, ironically giving the person new symptoms to worry about. Doctor-patient relationship challenges. People with illness anxiety disorder often feel dissatisfied with the medical care they receive. They may feel dismissed or not taken seriously by physicians. While sometimes doctors may become frustrated or dismissive due to repeated reassurance seeking, this can damage trust and prompt the patient to look for new doctors. This repeated cycle contributes to feelings of invalidation and reinforces the belief that something serious is being missed. Conclusion. These are just some of the features and complexities of health anxiety or hypochondriasis. It can be an incredibly debilitating condition that affects every area of life, relationships, work, and even enjoyment of hobbies or leisure activities. I'll be posting future videos on effective approaches and tools for managing health anxiety. So if you're interested, stay tuned.